everyone. Welcome back to the show. I'm Roxann Klepper, and this is Brick by Brick. So, you remember a while ago we had Dr. Brooks on the show, who was incredible and shared some great information with us. She talked about pelvic floor health for a little while, and I thought, you know what, that is something that I want to talk about because I think it's so much more prevalent than we all think it is. So, I'm super excited today we have Kelsey with us. Kelsey is a physiotherapist, but so much more than that. She specializes in pelvic floor health, urinary incontinence, pelvic pain conditions, colorectal disorders, prolapse, menopause, and visceral mobilization. And don't worry, I don't know what any of those are either. But Kelsey's here and she's going to help us understand what all of those are. So, welcome to the show, Kelsey. We're super excited to have you.
Great. Thanks for having me.
Kelsey and I chatted a little and I sort of had some things that I wanted to ask her. So she's going to dive right into it and sort of explain the whole pelvic floor health thing and how it affects so much more than just what we think it does.
Okay, so pelvic health is definitely encompasses more than just pelvic floor and doing Kegels. Your pelvic floor really is part of your whole core and the makeup of stabilizing your pelvis. And so it's really important and related to bladder health, to bowel health. Um, as well as important during prenatal and postpartum and can affect us during menopause. So, everybody has a pelvic floor, including males. And so it's important to be able to know how to use it and how it can support us.
And so in our everyday life, I'm assuming we don't we don't exercise it properly. We don't do anything with it. We kind of just expect it to do what it's supposed to do, and then obviously it stops doing what it's supposed to do.
Yeah. So times where it can kind of become an issue commonly are during menopause, and that's because there's a lot of hormonal changes that happen. So during menopause, our hormone levels are changing, our estrogen levels are declining, and estrogen's really important for basically vaginal tissue health and support of the bladder and support of the pelvis. And so when we see those estrogen levels drop, we also see a drop in our decrease in muscle tension, our muscle tone throughout our whole body too. So we as our estrogen levels decrease, we lose muscle strength, and that can be in our pelvic floor as well. So that's when we often start to see these issues with prolapse or incontinence or bowel and bladder stuff start to become a little bit more prevalent in women.
Okay.
But we can also see this stuff in kiddos as well. Kids, we treat kids, and kids can have pelvic floor issues. Things that's just constipation or bedwetting are classic signs that there's a pelvic floor dysfunction in a pediatric child as well.
I didn't know that. And so
Hmm.
can you tell me what prolapse is? I actually hear that all the time and I have no idea what it
Yes.
is.
Yes. So prolapse is when there is laxity or a stretch in the connective tissue that holds up our pelvic organs. So that
Okay.
can include either your bowel or your rectum or your uterus. And so that often becomes more prevalent. So after childbirth or postpartum, a vaginal delivery, there's been a stretch of the connective tissue that holds up those organs, and we can see them start to descend downward a little bit. And so
Okay.
symptoms of that would be like heaviness, pressure, sometimes leakage, and often like a feeling of discomfort and the inability to exercise or put any pressure on it.
Okay. Okay. And so speaking of leaking, obviously, is there a word for, and I know women joke about it all the time, but like, you pee a little when you sneeze or you're, jumping on a trampoline. Is there a term for that? Is that a real thing or is that just something that happens all
Yeah,
the time?
so the correct term is called stress urinary incontinence. So when there's a downward pressure onto the bladder,
Mhm.
um, there if that pressure exceeds what the capacity of the pelvic floor muscles can do, then we'll have leakage associated with that.
Okay.
So oftentimes our treatment of that, usually we're working on balancing the pressure. So it's more than just Kegels. We're working on balancing the pressure. So that comes back to encompassing core strengthening and managing intra-abdominal pressure downwards. So we're not pushing down as much. And then we're getting good, proper function of pelvic floor and the timing coordination of those muscles when we're jumping as well.
Oh, interesting. You always just think it's just those muscles. You don't realize how connected they all are.
Yeah, especially with that link to our core. It's your core, but pelvic floor is your core and your stability. So if we're missing a link in our core, either overactivation in certain muscles in our core or underactivation, or the hips play into this as well. If we see either weakness or tightness in hips, that can affect our pelvic floor's ability to function, and then that can be leading to issues, especially with incontinence. So it's really looking at all the muscles around the pelvis, not just the pelvic floor in isolation.
Sure. Okay. And so you obviously work at L Physiotherapy, and so tell me what it's
Yes.
like when someone calls in and they say, "Hey, this is what's happening." What does that process look like? How do you help people overcome these things?
Yeah, so we would do an initial assessment first. So this is like a 60-minute exam, to a lot of history and a lot of education. So we're taking a thorough history on all the symptoms from bowel, from bladder, to any previous injuries, to birth history. Then we're doing kind of a full postural functional screen. So we're looking at alignment and posture and breathing and stability through core and through your hips. And then we would dive into assessing the function of the pelvic floor muscles. So we're looking at not just the ability of them to contract, but also the ability to relax as well. So both of those are really important to have a good functioning muscle. We can have leakage or any pelvic issues such as urgency or even difficulty with our bowels if our pelvic floor muscles are tight as well. So a tight muscle is not able to activate very well. Like it doesn't have great range of motion. So I always explain this to clients. If you kind of think of your bicep, if I want to have a strong bicep, I need to be able to relax the muscle all the way, and then I need to be able to contract it all the way. And if I do my exercise strengthening it through full range, that muscle is going to be strong. Pelvic floor is the same. If we've got tension in the muscle, then I'm not, when I go to try to activate it, I've got no power there, and I've got nothing. I can't get any activation out of the muscle. So doing more activation exercises therefore is not going to be beneficial. So in an assessment, we're really looking at what are the appropriate exercises that need to be prescribed? Is there tension that we need to work on actually releasing pelvic floor, or changing posture or alignment, or looking at, again, the hip or the pelvis that we do exercises or stretches for? Or do we need to work on strengthening everything up, core, pelvic floor, hips, and then giving a individualized program, not just exercises, but also education on bowel and bladder, kind of habits and daytime routine and things that we can do in our daily life to help your symptoms.
And okay, and so how many people, I obviously you don't know the answer to this question, but I'm assuming there's a ton of people out there who have these issues and think they're just
Yes.
you just got to deal with it. There's no way out of it. There's no fix for it. So all of these men and women, correct?
Yeah. Yeah.
Okay, come in and there is a fix for these things.
There totally is. Yeah. There's lots that we can do. And we're often told that it's aging, or, oh, you just had a baby and it'll just get better. But often it doesn't get better. Like there's
Right.
things that we can do to help treat this, and more than just going for surgery. Like there's lots of things that we can try in strengthening first before a surgery should even be considered.
Oh, wow. And so I know you and I joked about this before, but we had some myths that you were going to chat about, some myths and
Yes.
and whatnot. Okay, hit us.
Yeah, so we've talked a little bit about these already. So pelvic floor is not just Kegels, and not everybody needs to do Kegels to get their pelvic floor stronger. So, like we talked before, if there's tension in pelvic floor, then the muscle's not functioning well, and it's not doing more tightening is not going to make it better. So, symptoms or conditions that would kind of make you think that tension is an issue, would be like persistent hip or low back pain, constipation, urgency, painful intercourse. Those are all kind of signs that there could be more so pelvic floor tension, not just weakness.
Okay.
Um, the other thing to talk about are like myth buster is that painful sex and painful periods are normal, and it's something we should just deal with. And so that is completely false. Painful periods, especially if you see this in kiddos or adolescents, are not normal. There it definitely is. It's something that we kind of brush off and we're told to just deal with.
Right.
But if periods are affecting daily life and our ability to our quality of life, our ability to get to school, to get to work, then that can be a symptom of endometriosis, and we're learning a lot more kind of about that and how to manage that. But that's something that that you can seek out and get treatment for. Um,
Okay.
Painful intercourse as well is something that is not normal anytime in life, whether it's postpartum or postmenopausal, and it can be due to either tissue irritation from hormonal changes that happen with menopause, or pelvic floor tension is a huge one. And so there's tons of treatment that we can do for that as well. Sometimes we need to work again with the doctor, like working with Dr. Brooks, getting hormonal kind of treatment for getting the tissue healthy, but then also working on teaching the muscles how to relax.
Okay. And we've mentioned Kegels a couple times now. I heard that, and a friend of mine was at the seminar that you did with Dr. Brooks, and she said you guys talked about Kegels and how, like, and bust this myth for us. Are they really doing us any good when we're doing it at home? We're sitting in your car and you're doing the little contracting in that, but is anyone actually doing them properly? And is it doing us any good, or are we just clenching our butt muscles?
Yeah. If you do them correctly, yes, absolutely. They are good, but not I would say 95% of the people that I see are not doing them correctly. That's the problem. And that's maybe why you feel like you're not getting better, is because they're not actually being done correctly. So Kegels are more than just squeezing your muscle tighter, or often we see, yeah, people just squeezing their butt. And
Yeah.
so when we're teaching Kegels, our one kind of tip for home is that we want to coordinate it with our breathing. And so that's how we teach the muscles how to work through their full range of motion. We need to be able to relax the muscle all the way and contract the muscle all the way. And it coordinates with our diaphragm so this links back again to that core. Our diaphragm and our pelvic floor are part of our core, and they move kind of, think of like a piston together. So when we breathe in, our diaphragm will contract, and which means it moves downward into the pelvis, and that creates some pressure downward onto the pelvis and the pelvic floor muscles. So if you picture them like a trampoline, those muscles need the ability to lengthen to kind of absorb that pressure. And when we breathe out, the diaphragm and the pelvic floor will rebound or kind of recoil back up. So we train our Kegel with that. When we inhale, we want to think about breathing into our belly and relaxing the muscles first. So we relax them to set them up to then be able to contract. So we breathe in and we relax. And then when we breathe out, we want to think about squeezing and pulling up and inside. And that pulling up and in is what creates lift, especially up on the bladder and the urethra, which is really important for leakage. So oftentimes in clinic, we see people are really just clenching the back part of the muscles or clenching your glutes, and we're
Yeah.
not getting that support up towards the bladder that we need doing a proper Kegel exercise.
Okay. And so there's probably a lot of people out there who maybe don't have any of these symptoms and nothing is bothering them right now, but how often do you see that later in life, after birth, menopause, all these things, that those muscles being strong are a huge benefit to those people that then don't have problems? So basically
Yeah.
everyone should be doing these, right?
Yeah, absolutely. And then we often, like we talked before, we often see that we might be okay going into menopause because we've got hormones to rely on. And then once we see these hormonal changes happen, if we didn't know how to use our muscles well, then we start to see some of these incontinence and prolapse and these things kind of happen. So going in and learning how to use your muscles properly before can really help on later in life, and it can go down to even incontinence can cause us when we're elderly to have to get up in the night and go to the bathroom, and then we have a fall, and then we end up having to move to a care center because we've now fallen, and our mobility's a concern, and all because of incontinence, of something that we could have worked on. Like, you're never too old to work on it, but it's good to go in and learn how to use pelvic floor early. So we like to see our clients, we treat a lot of women now prenatally.
Oh,
So
okay.
learning how to use their pelvic floor before you have a baby, prepping for labor delivery. So learning how to relax your pelvic floor and minimize risk of tearing and prolapse with delivery. And then doing a 6 week postpartum assessment to really get, we do a full assessment of core and pelvic floor, and work on building kind of strength and core back up postpartum, and doing that before we have issues. If we can catch things early, then we're in a better place going into a next pregnancy, or going, later on to life into menopause as well.
That's so smart. I think it's one of those things you never even think about doing before you give birth, right? It's like,
Yeah,
why would you fix it first? That's so
yeah.
smart.
Yeah. So it's really cool that it started to transition more
Yeah.
preventatively than
Right.
waiting till something is happening and then come in. That we're seeing, yeah, a ton of prenatal. If we can minimize injury going, like, in birth, then there's going to be less complications later in life, less need for surgery, less incontinence, just overall better quality of life, able to get back to exercise and doing activities you love without having issues because we're getting on it sooner.
Oh, I love that. And so when you said incontinence, for people who pee in the night already, I just wanted to go back to this. Is that already the first signs of poor pelvic health? Peeing in the night?
It can be. So it's often associated, like, if you have frequency or urgency in the day, you'll have, or sometimes even worse, urgency at night. It is normal to go pee, one time in the night is okay. It's not ideal. Any more than that is not normal and very disruptive to your life if you're getting up more than one time in the night to go
For
pee.
sure.
Like, ideally, nor not at all. Um, Under the age of like 60, we shouldn't be getting up in the night to go pee. So yeah, if you're
Okay.
getting up 4 times in the night to pee, or you're running to make it to the bathroom on time, or barely making it to the bathroom to go pee, those are all signs of urgency and pelvic floor dysfunction.
Okay, interesting. I have one more question that I wanted to ask you. What is visceral mobilization?
So it just works on um, kind of the organs in the body. So I use it more for bowels, of just kind of stimulating bowel motility. So just, it's really kind of deep massage through the abdominal wall. And I use it more for bowels and for management of constipation. So just trying to
Oh,
wake up the
okay.
bowels and get increased motility through the bowels, which then, if we often treat bowel concerns with bladder issues. So
Okay.
constipation is a huge driver for urgency and incontinence, because if we're full of stool, that's going to press up against the bladder, and then that can contribute to leakage. So we need to
Sure.
really manage constipation to be able to get bladder concerns. And especially in kids, that's the number one kind of factor that can lead to bedwetting, and incontinence in kids, is constipation.
Oh, wow. Oh, so interesting. And again, I bet that's something that people just think, oh, hey, we didn't drink enough water, or we blame it all on so many other things, but there is fixes for these, especially the bedwetting.
Totally.
That
Yeah.
can be a
Yeah.
huge confidence hindrance for kids and stressful for parents. And oh, wow.
Yeah, exactly. And often we're told, oh, you'll just grow out of it. They'll grow out of it. And lots of times they're not. And now they're 10, 11, 12, and
Oh,
then finally coming in, and these poor kids that's,
right.
not able to do sleepovers, or having leaking at school. And we address the constipation, and then the leakage improves with
Oh,
that.
how
Or
interesting.
it's one of the big factors that you kind of
Yeah.
assess first in kiddos, especially, but even going into adults. So if we kind of talk prevention again, if we can get these good habits developed in kids, oftentimes when I am treating adults and they're like, oh, I've been constipated since I have a kid and I've had all these bladder issues since I was a kid and now we've had babies and we're menopausal and then things just compound.
Oh,
Like if we can treat these good habits when we're young, then we can we can expect less issues in the future as well.
for sure. For sure. Okay. And so for any of our listeners out there and they're like, hey, I have the symptom or my kid and the bedwetting and the anything, how do they get a hold of you? How does this process work? They just set up the consult first? Can they book online? All of those things.
Yeah, so you don't need a referral to come see us. You can just either call the clinic. You can look on our website and you're able to book online. So if you have questions, you can always call the clinic for us to answer. I'm also happy to leave my email if anybody has any questions as well. We are a private service, so there's no coverage through Alberta Healthcare for physiotherapy at all. So this can be covered through benefits. So any extended health company or insurance that covers physiotherapy, there can be coverage for pelvic health physio. We just there's no coverage through Alberta Healthcare. So that means we don't. The only way you would need a referral is if you require one for your insurance, which most companies don't require that anymore.
Okay, perfect. And so, just so everyone knows, I am going to include all of Kelsey's info at the bottom of the podcast. So, website link, her email, phone number to the clinic, all of that good stuff in case you want to reach out. And obviously, by the sounds of it, it's something that we should all do. So, hopefully, this information was super helpful and was super helpful to me. There's some good information in there that none of us learn or know.
Yes.
So, thanks so much for being with us, Kelsey. I super appreciate it. Thanks for all the great
Yeah,
info.
no problem. Yeah, thank you for having me.
Yeah, okay, have a good night.